The meeting to order. First order of business, if you would join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'm going to just hang my my mask to the side for this so you can hear me speak a little clearer maybe. A couple of things tonight. I'd like to adjust the agenda a little bit if you have a copy of that. I'd like to move items B and C up before the presentation from the task force so the board can get its business out of the way first before the presentation, if any of the board members have an issue with that. Okay. I'd like to thank everyone for coming tonight. The way we're going to run the meeting tonight, the public input section, we're not going to do at the beginning of the meeting. We're here to listen to you after the presentation. It makes little sense, I think, to have some people come up and talk before they actually see the presentation. So we're going to eliminate the public input at the beginning of the meeting. After the presentation is done, anyone who would like to speak will ask to go to the microphone in the middle of the floor. Again, keep social distancing if there's a line of people. And everyone will have 5 minutes to present their thoughts. We're here tonight to listen. I know there's a lot of difference of opinions. Please respect everyone's differences because this is a tough decision for everybody to make. On that, we're going to start the meeting with acceptance of the minutes of our July 14th school board meeting. I'm keeping my little chart, so who moved? Charlene moved. And Dr. Jim, second. Okay, roll call vote. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Jim Pittman?
Yes.
Charlene? Dana? Yes. And chair votes aye as well. Thank you. The second is approval of the manifest from June, which was a total of $4,022,380.54.
So moved.
Okay, it's moved by Tim, seconded by Dr. Jim. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Yes. Jim Pittman?
Yes.
Charlene? Yes. Dana? Yes. And chair votes aye. The second set of manifests are from July, and the total for the manifest for July are $7,989,455.50.
So moved.
Okay, moved by Tim, second by Dr. Jim again. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Yes. Jim Pittman?
Yes.
Charlene? Dana? Yes. And chair votes aye as well. And now, Superintendent, you want to take the next two, the authorizations?
Sure. So the authorizations are for, I will just read them so that everyone knows what they are. We, the Governor Wentworth, can everyone hear me okay with the mask? Yes? Okay. We, the Governor Wentworth Regional School Board, recognize that Kathleen Cuddy-Egbert, Superintendent of Schools, and Heather R. Cummings, Assistant Superintendent, as our representatives, and authorize them to suspend students from school for up to 10 days in accordance with RSA 193:13(1)(b). The superintendent may designate this authority to the school principals and assistant principals. Furthermore, the superintendent and assistant superintendent are authorized, following a hearing, to continue the suspension of a pupil for an excess of 10 school days up to a total of 20 days. Okay. And I'm sorry, do you want me to do both? Or? Okay. And the next one is, we, the Governor Wentworth School Board, authorize Superintendent Kathleen Cuddy-Egbert, Assistant Superintendent Heather R. Cummings, Business Administrator Kathy O'Blenis, and/or Director of Curriculum, Caitlin Hills, to sign the assurances for all grants and requests to and from trust funds.
Okay, I would entertain a motion on the first for authorization for the suspension. Okay, moved by Tim, seconded by Dr. Jim. Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Jim Pittman?
Yes.
Charlene? Dana? Chair votes aye. And on the second authorization to sign assurances for grants.
So moved.
Okay, moved by Tim, seconded by Dr. Jim. Okay, Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Jim Pittman?
Yes.
Charlene? Dana? Chair votes aye. Okay, so that kind of concludes the little bit of board stuff we needed to get out of the way in a hurry. So at this point, I'll turn the meeting over to a superintendent to go over the reopening task force plan.
All right. Well, first, I want to thank you all for being here. The pandemic certainly has handed us some very, very tough choices. And I think there's no doubt that everyone wants all of our children back at school. Unfortunately, we need to think about the balance of safety and what it means for them to be back. I can tell you from my emails that there are many different opinions about this and very little agreement. So I appreciate you taking your time to come here and hear about what the task force has put together. I want you to know that no school board decision has been made. This is a proposal. It can certainly be modified. I know that I would like to hear, and the board would like to hear, all of your input before a final decision is made. Those of you who are a little bit far back in the auditorium, you're going to want to make sure that you have the handout in your hand, because the further back you get, the more difficult it is to see the screen. So I want to make sure that you all have the opportunity to see it. So we have a lot of copies. I thought there would be a lot more people here tonight. So take advantage of that and grab a copy. So to start with an overview, we had 6 subcommittees and 32 members from across 2 districts, Governor Wentworth and Middleton. Our primary source in this document was guidance from the Center for Disease Control. And as you can see, the screen behind me will probably be saying that the 6 committees were health and safety, food service and transportation, physical plant, teaching and learning, mental health and social emotional, and technology. Each committee had experts in the area that they work in. For example, our health and safety committee had 2 nurses and an additional person with a medical background. I'm also appreciative because we have a pediatrician in our community, Dr. Matos, who reviewed the document and has made some suggestions which will be added to the document. Each group was asked to plan for 3 possibilities: full reopening, blended or hybrid, and fully remote. Once the task force made their recommendations, it was the administrator's job to determine how the plan could be implemented. If you've read the plan, you know it's a document that can be used as a handbook, and it links to many valuable resources, I hope, for parents and teachers. The task force did the work as volunteers, and I want to thank them so much because they had no expectation of payment, and they put in many hours and did really a fantastic job. We're going to review the report committee by committee. First is health and safety, and the first recommendation is screening. And it's going to be very important that each employee must take their temperature prior to arriving at work every day, and students will have their temperature taken before entering school. And I have to tell you that we haven't worked out exactly how that system will work. It might be that we have temperature-taking cameras at the entry of school. It might be that we have software that where parents download a picture of the temperature and the checklist, and it automatically goes to the nurse's inbox. And it might be that we actually have people working as students come into the building to make sure no one comes into the building without completing the checklist. So there are 3 possibilities there. If any of the following screening criteria applies to an employee or student, they must stay home, and the employee must notify their supervisor of the circumstances as soon as possible. And these are the COVID symptoms that you see behind me. The respiratory symptoms such as runny nose, sore throat, shortness of breath, flu-like symptoms, changes in a person's sense of smell, fever of 100 or more, household or family member with COVID-19 symptoms, and contact with an individual who has been tested positive for COVID-19 in the last 14 days. In addition to that, if a person has traveled outside of state, that's another indicator, and we would likely, if we have an employee that has been out of state, we would likely ask that employee to be tested before coming to work, or at the very least, and this is slipping down, so, or at the very least, that they would make sure that they have self-quarantined for 14 days. This is the protocol recommended by the CDC. And one thing that I do want to add here is after Dr. Matos' review, he sent some information about children's symptoms being a bit different. And so we will certainly work with that information and make sure that parents and teachers and school nurses have that information as well. Okay, so screening protocol. Students and staff will be screened each day before coming into school. I think I've talked about that. Persons with symptoms or who answer yes to any of the following items on the checklist must stay at home: temperature, flu-like symptoms, travel outside of New England, family members with symptoms, contact with a person who has tested positive. There will be a designated isolation room at school for students or staff with symptoms. The isolation room will be for students or staff showing the symptoms, and the nurse's responsibilities that are other than taking care of sick children will happen in the nurse's office. So there will be a definite division as far as those kinds of responsibilities go. And we, right now, don't have full-time nurses in all of our schools. There are 2 of our smaller schools that don't have full-time nurses. But the task force, and certainly I think it's a good recommendation, would want full-time nurses in all of our schools, including the smaller schools. So what happens if a person in school tests positive? I think this is probably one of the major concerns of parents and other folks, teachers. One of the most important parts of what you see here is informing parents. First, there would be a contact with local health officials for guidance. That would be the Department of Health and Human Services. Students are dismissed for a maximum of 14 days. All schools affected would be closed. So, for example, if we have students who have ridden the bus and they come from multiple schools, then we would need to make sure that those schools are closed as well. And when a school is closed, it's always been our policy that there are no after-school activities. Parents would be notified immediately. I really think that's important. I know that, I am a parent of 2 semi-grown children now, and it was always important to me to know what was going on in the school and to have the trust that the school district would let me know. So parents will be given as much information as possible without breaching confidentiality. All of these steps are in accordance with CDC guidelines, and should we need to close school for a couple of weeks, remote learning begins for that period of time. Specific cleaning protocols are also put into place, and I have to give kudos to our maintenance staff who have been right on all of this. Next would be When may a staff or student return to school? A person with COVID-19 symptoms who has not received a test may return when the following conditions are met. There has been no fever for 24 hours or 1 day without the use of medicine. Other symptoms have improved. At least 10 calendar days have passed since the first symptoms appeared, and a release from a physician has been provided to the school. There's a little bit of a difference when a person has been a confirmed exposure. There's, again, no fever for 24 hours. Other symptoms have improved. At least 10 calendar days have passed, but the biggest difference is that evidence of a negative COVID-19 test from a physician has been provided to the school, and that really was a recommendation from Dr. Matos, which I think is just a great recommendation. Next is implementation of behaviors to reduce transmission. One of the things that parents were concerned about was sanitization and hand washing. And frequent hand washing is really important in the mitigation of, and I'm sure many of you have looked this up and know that. And frequent hand washing will be encouraged before and after meals, after using the bathroom, blowing nose, coughing, sneezing, after touching surfaces that have been touched by many other individuals. The plan contains guidance on how to wash hands properly for families and school staff, and there's a great video. Cheryl Kravitsky, our person who works, our teacher who works in the Lakes Region Technology Center, just put together a great video. You really should click on it. It's really great. And Dr. Matos also sent a video, which will be included as a resource. Antiseptic soap is present in all of the restrooms. Hand sanitizer will be available in all classrooms. Several hand sanitizer stations have already been installed throughout the schools in close proximity to classrooms, gyms, library media spaces, and offices. We've tried to make it easy to make changes in the physical environment so that students and staff are able to keep their hands sanitized. All right. So, mask wearing. Students will be required to wear masks. We ask that students come to school with masks, although if they're unable to, we certainly will provide masks for them if needed. Mask breaks are appropriate during meal times and snack times. Staff members will be able to determine when short mask breaks are needed and appropriate, although we will be developing the criteria for when a mask break is appropriate so that teachers will have some guidelines to work with. The plan contains advice on what constitutes an appropriate mask, and there's a link to an article on properly wearing a mask, putting it on, taking it off. And of course, we will absolutely need the cooperation of parents to make this successful. Right. Physical distancing. Students and staff will be adhering to CDC guidelines of 6-foot physical distancing, and that includes not just the classroom, but hallways, and seating in classroom or other spaces, bathrooms, lockers, locker rooms, office. Desks will have clear plastic 3-sided shields as another layer of protection. As far as the physical distancing, again, it is a CDC recommendation and best practice. As lockers and bathrooms, we will also be marking especially in the boys' bathrooms, we'll be marking every other urinal or whatever is the appropriate social distance in those bathrooms, and lockers will be assigned in the same way to promote that social distancing. Sanitary classrooms and spaces, frequently touched surfaces, and this is really all about physical plant and the work that our custodians have been doing, and they have been right on top of this. I'm going to put this on again. The frequently touched surfaces, such as door handles, desks, and faucets, are cleaned between uses and throughout the day. And each night, of course. Restrooms will be checked and cleaned throughout the day, and I think I've explained that the urinals will be socially distanced. Students will be given their own crayons, markers, pencils, and which were often previously shared items, but it's going to be really important to keep things separate in terms of crayons, markers, when kids come in with coats, hats, that sort of thing, that they all be kept separate. And we may learn later that that's not necessary, but right now there is just so much that's unknown about the coronavirus that I think it's best to be safe. And as we learn more about it and we can relax the standards, great, but we don't want to relax standards too soon. All right, let's see. Carpets will be washed on a weekly basis. Water fountains, this is really important, will remain out of operation during this time. Students will be provided with bottled water or water stations where they put a cup under a spigot so that we don't transmit anything through the water fountains. And this is another very important thing. The HVA systems will be programmed for maximum air exchange and the highest grade filters. The highest grade filters are MERV 13 and 14, and all of our systems are capable of handling that. We're very fortunate that we have great HVAC systems in our Kingswood complex, and even some of our older buildings have been upgraded. So we're able to use the highest grade filters in those situations, which I think is very important, because I think we may find down the road that air circulation and transmission within a building really does have something to do with the air circulation. So we also will be purchasing software through the CARES Act so that we can provide that continuous outside air circulation in our buildings. Physical plant, most of that was physical plant, and I want to thank Kathy O'Blennis for chairing that committee. Our custodians have been on this since last March. They've been doing a fantastic job, our custodians and building and maintenance folks. They have had guidelines long before this situation, long before the pandemic, and they've always done a great job managing the guidelines from how laundry is done, and there are special procedures for cleaning areas when there's been a confirmed case of COVID. They are well aware of that, and they certainly will be following all of the guidelines. Only approved disinfectants are used in the school, and they will be installing the plexiglass in various areas to make sure that staff are safe and students are safe. Okay. All right, some other really important things. Field trips and off-site activities, all field trips will be suspended at this time. Outdoor field trips within the school district communities related to the curriculum must be approved by the superintendent. And this would be things like if we have a class that's a science class that wants to go outside to maybe take some water samples. If everyone is social distancing, we know that outside is actually preferable to inside, so that might be an appropriate outside activity or field trip. So we don't want to restrict things that are good for classes and kids unnecessarily. So there's a delicate balance there. But a trip to the Boston Museum of Science, no. Okay, and we'll do everything in our power to hold virtual activities in place of school-wide activities and assemblies. Open house is an example. We certainly do want to communicate with parents, and we want parents to know what's going on in the schools. So we will need to develop some virtual activities where parents can see what's going on in my child's classroom. And I want to talk to the teacher, and I want to know, what the year is going to look like. So those things will need to be developed for parents. Visitors in the school will be discouraged and required to make an appointment. Virtual meetings will be held whenever possible. Vendors and repair service folks will need to make, and other essential procedures they will need to make an appointment and they will need to be screened, including the temperature check and all of the screenings that students and staff partake in. They will need to be a part of that too. Professional development resources will be provided for staff, particularly on infectious disease transmission, COVID-19 symptoms, the screening process, and proper wearing of masks and social distancing. And some of those, if you have looked at the document, you'll see some of those have been embedded in the document, and I think the folks that created those did a really excellent job. And then finally, playgrounds and fields. Outdoor play will occur in shifts with smaller groups, so even outside, we want to keep students socially distant to make sure that they're safe. And certainly outside activities will be encouraged because we know that outside is much safer than inside actually, because the effect of air and sun have on the droplets. Although on our playgrounds, the CDC does not recommend that you sanitize necessarily playground equipment, but those pieces of playground equipment that we have that are metal and plastic, we are going to be asking that our staff members, custodial staff, do sanitize those until we have further information about touch surfaces and COVID. Food service. Most of you probably know our food service employees have just been rock stars. They have kept everything going from March right through the summer. They've made sure that all our kids have breakfast and lunch, and we want to continue that. So there are certainly procedures for food service staff members like everyone else. They'll be 6 feet apart. Areas will be sanitized before work begins. Food service employees will be wearing a mask, shield, and gloves. Breakfast and lunch will be provided to all students. I love this part. Meal choices for the elementary students will be identified by the color of the bags. The middle school students will keep students in cohort groups as much as possible for lunch. At the high school, lunch times will be staggered and arrangements made to reduce the number of students in the cafeteria. Lunch tables will be arranged to ensure social distancing. And I want everyone to know that the food service folks have planned, just like every other committee, for 3 different scenarios: for being fully in school, for being hybrid, and for being fully remote. And no matter which plan occurs, students and the children in our school district will be fed. I think that's really important. We have also coordinated with 68 Hours of Hunger and the Kingswood students, Nights Against Hunger, to make sure that those families that need food on the weekends still get that, whether we're remote, blended, or fully in session. Additionally, as we think about what would happen in school, symbols on the floor to ensure students remain 6 feet apart, one-way routes for exit and entry when students are not eating lunch in their home classroom. Packaging of lunches will be disposable. Students will be required to wash and sanitize their hands before and after lunch. If school is in session in a blended model, students will be provided with, as I said before, with breakfast and lunches to take home for the days they're not in school. If school closes due to community transmission or approaching community transmission, families will still receive meals for their children. Meal distribution will continue where it has been at the high school and Ossipee Central School. And again, as I said earlier, the weekend bags will still go home. Transportation. Transportation is actually one of the toughest areas. You may know that we are geographically the largest district in the state, which makes transportation a bit of a difficulty. If we keep 6-foot distancing, then that allows for 13 students to ride the bus. Now, you know this is a district of 2,400 students, so you can imagine the dilemma that poses. So transportation is most definitely likely to be one of our biggest challenges. 6-foot distancing allows for 13 students to ride the bus. So the first thing that we need to do is to ask parents to transport their own students. From our preliminary survey, we'll be doing another survey, but from the preliminary survey, we have an indication that there are many families that are able to do that, which is great. We won't know exactly what we need to do until we put that second survey out and we find out just how many parents can transport and just how many parents really don't have any other way. They don't have a car or they just don't have any other way to transport their children. So once we know that, we'll get a better handle on whether we need to stagger our schedules to make sure that everybody gets to school. But it will definitely be a challenge, but I think it's a challenge that we're up to. The protocol for students entering the bus will be, they'll enter and exit the bus one by one. For students entering the bus, they'll go to the back of the bus, and the bus will be filled from there up to the front. When students are exiting the bus, the first student will exit first, second, because we don't want students passing each other. Again, we want to make sure that that social distancing is occurring. It's important to know that siblings will be seated together because we want to conserve as much area in the bus as we can to make sure that we can transport as many students that need transportation. And they'll be seated together. So siblings will be seated together to conserve room. Parents will be asked, if parents are dropping off their children, this will be important. Parents will be asked or required to stay in their cars, and we will have staff members come out to meet the younger children, again, to make sure that we have that social distancing and are protecting everyone. As I said, staff members will assist with the younger children. Teaching and Learning Committee. Teaching and Learning Committee was co-chaired by Katie Hills, our curriculum director, and Susan Merrill, our special ed director, and actually student services for counseling as well. So I'm going to ask Katie and Susan if they would comment on teaching and learning.
We also looked at the 3 different models, and obviously if we are back in school full time, we will be, teachers and students will be abiding by social distancing and other safety protocols, which will affect instruction to some extent, but obviously the most changes would happen if we were in a hybrid or blended or fully remote model, and so most of our time was spent discussing those 2 particular models. In regard to special populations, students will receive services regardless of what model we return in. Special ed and related services will be provided in person if possible, and if that is not possible, it will be done through a live or synchronous meeting, either through Google Meet or Zoom. We want to make sure that all students receive access to materials that might be needed in order to access remote learning. And so we will arrange through special education staff, families, and administrators to make sure that those materials get to the student. For special education process, plans, and timelines, we will make sure that those are followed per whatever guidelines we are getting from the state if they should be changed. And that would happen under the guidance of Susan Merrill, the Director of Special Education. And there's also the possibility of additional in-school support if we are open in a blended or in a blended model. For certain populations to be in school every day, these students might need more support, such as special education students, ELL students, homeless students, and other populations. That would obviously not happen right away, or it might not happen right away. We would need to follow the trajectory of how it's working out with students and staff in the building. We also talked about meeting norms for staff and students. For teachers, we want to make sure that similar to when they are in an actual classroom, that if they are online in any capacity, that they are greeting students during live or synchronous meetings, They're establishing a positive culture. They're sharing learning goals and objectives, and they're checking in with students to, check for understanding. For students, we want to really develop that idea that even if you're at home attending a meeting, that you're still learning, you're still in school. School just looks different. And so we'll ask that students be on time for their meetings, that they show their face and act appropriately, that they actively participate, and that they minimize distractions as much as possible. We recognize that home situations vary, but as much as possible to make it a good environment for learning. We also came up with 4 expectations for remote learning. The first is to complete all assignments with the idea that we're really focusing on assigning purposeful work, work that's really going to further a student's understanding of a topic or skill. The expectation is that students will contact the teacher for extra time or help, that they will attend every assigned meeting unless a parent or guardian notifies the teacher, and that they will follow digital and classroom citizenship rules. We also spoke about attendance expectations, particularly this is strange in a remote learning environment. What does it mean to be in attendance if you are at home? And we really focused on engagement, having teachers create assignments and lessons that are engaging for students, attending meetings with purposeful instruction, so actually having some interaction between teacher and student, completing purposeful assignments related to learning, either as a practice following a lesson, or potentially in the flipped classroom model, doing some pre-learning before going into a meeting, a remote meeting, and being able to have discussions around something that a student has pre-learned. And as in a real, or as in school, it is the expectation that teachers would follow up with students who are absent, and that if there are some extended absences, that teachers reach out to administrators to seek further support. One of our biggest conversations was around what does learning look like in either a blended or fully remote model. And we followed the tenet that all students should have access to synchronous and asynchronous instruction. So synchronous instruction, sometimes called live instruction, should be purposeful. It may include pre-teaching, it may include discussion, guided practice, or sense-making activities. It may be done as a full or partial class. It may be done in small groups or with individual students, depending on what works best. But that is really where some of that art of teaching comes in, is that interaction with teachers. Asynchronous instruction may include watching pre-recorded lectures or videos, reading, and doing independent practice. But we really want to emphasize that it does not have to be all online. Reading a book, for example, is asynchronous instruction, but it doesn't necessarily happen in front of a device. The committee also created some minimum time requirements for asynchronous and synchronous instruction, and those were staggered according to grade span. Obviously, for our younger students, our kindergartners, our pre-kindergartners, they would be expected to engage for fewer hours per day than our high schoolers. But we have some guidelines there to make sure that students are getting access to an adequate education. And finally, regarding instruction, we really are going to be focusing on our priority competencies in a blended or remote model, both academic competencies and work habits, to really narrow down, what is essential to learn, given that we won't, in those 2 models, we have less access to time with students. And finally, the last 2 areas that we discussed were assessment and grading and scheduling. Regarding assessment and grading, we spoke about how formative assessment should be selective in grading, and it should focus on constructive feedback. So giving teachers that permission that they don't have to grade everything, but it's very important that when students are submitting work, they should give them constructive feedback to help guide students through that learning process. Summative assessments should focus on creation, the idea that these assessments are authentic, performance-based, or really focusing on those higher order thinking skills, which aren't necessarily the assessments where you can just Google the answer. We talked about students having the opportunity to retake assessments within reason, especially because there can be a lot of outside factors if students are at home during the learning time. We will use the same grading scales as pre-COVID school, so that is the 1 through 4 scale for K through 8 and the 0 through 100 scale for high school. We talked about using rubrics aligned to learning targets and having teachers enter any scores into the grading platform, whether that's jump rope or power school, within 1 week, so that families, both students and parents and guardians, can stay abreast of how their student is doing. And finally, we had some scheduling suggestions. While we did not create any schedules, leaving that to each building, we suggested that at the elementary level, where classrooms are contained, students have 1 teacher, that teachers survey those parents to help build a daily schedule, that we provide flexibility to potentially have students meet across classes, that we work to integrate content, different content areas and different skills, and finally, really emphasizing that collaboration between teachers and special ed providers so that students aren't overwhelmed if they are both in the general, receiving special ed services while also with their core teacher during the day.
Okay, thank you so much, Katie. The other thing I want to mention as far as teaching and learning, we know we have some students who, because of certain needs, require 5-day learning. And that is something that our special education teams and our teams at the buildings will be taking a look at so that we make sure that those students don't, to use an overused phrase, get left behind. And our next section and subcommittee is mental health and social emotional considerations, and Heather Cummings was the chair of that group. So Heather.
Thank you. Good evening. I too want to echo Kathy's gratitude to the committee members. It has been a lot of hard work, and we're just so grateful. And particularly to this committee in mental health, I'd like to thank Susan Merrill as well for the support in her role with counselors. The considerations that our committee share with you this evening stem from results of the survey sent to parents and guardians not too long ago. We were encouraged to see that almost all parents or guardians felt that their child or children could demonstrate the ability to form and maintain a routine, manage their emotions appropriately, and maintained a positive relationship with at least one adult in their school, both prior to COVID-19 and during. While the numbers dropped a bit during remote session instruction, the feedback was still encouraging. Not surprisingly, managing emotions appropriately and struggling with a sense of connection and belonging were the 2 areas of most concern during remote instruction, with connection and belonging being a concern for about 1/4 of those who responded as we looked to school reopening. In addition to the survey responses, we reviewed resources from the American School Counselors Association, the National Association of School Psychologists, and the Collaborative for Academic, Social, and Emotional Learning, to name a few. It is with this in mind that the committee members felt it paramount to be proactive in assessing and addressing the social emotional well-being of students and staff with commonalities across all grade levels and all possible school reopening scenarios. You'll see on this slide that we felt a goal and area of focus would be important to share so that there's an awareness of what our strategies and resources will circle around. On the next slide, you see the areas that emerged as common threads as we divided our work by the 3 grade spans. While the strategies and outreach might look different at each level, we found it critically important that these 5 areas be consistent from elementary to middle to high school. establishing connections, bringing closure to the previous year, and building in multiple ways to help students and staff settle into the new and unfamiliar ways of being back will be so very important in the first weeks of a face-to-face return. In addition, there will be the added complexity of anxiety, fear, sadness, and tension around the current circumstances, and teachers and students alike will need our support. While returning to some of the same spaces and resources will bring a sense of stability for some, there will still be a need to reacclimate to the supports that were in place prior to COVID-19. These include systems of support that are steeped in best practice and focus on multi-tiered systems of support for academics, behavior, and social-emotional well-being. Here you see on this slide just a few that were identified as being in place for your children. At the elementary level in a blended model, the days when students are face-to-face, it will be a high priority to ensure that routine and assessing the needs of individuals is occurring to allow for as seamless a flow of support as possible when students are not in classrooms. This brings us back to the importance of our goal and being proactive in our establishment of routine and support. Should a remote model be in place, consistent communication will be key to a continuum of support, not just for the elementary students, but across the entire district. The committee has reviewed resources that could be utilized to integrate social-emotional learning and supports virtually, as well as placing a strong focus on updating families on a frequent and consistent basis so that they know the resources available to navigate the nuances of the remote environment and its impact on students' emotional well-being, as well as families as a whole. While the previous things I have shared about considerations for elementary students pertain equally to middle and high school, in the face-to-face model for middle level, social connection is such an important factor in adolescent development, particularly as 7th graders come together as one school community for the first time. Advisories at the middle school are a place where building connections based upon social, emotional competencies, such as self-awareness, social awareness, self-management, and relationship skills can really be impactful. Much like the elementary level with their multi-tiered systems of support, the Student Support Center is a place where both academic and emotional needs can and will be met. At the middle level blended model, much of what is done face-to-face can be reinforced both in school and remotely. This is where the work to establish connections will likely be most evident for us. In an all-remote model at the middle level, community partnerships that we have established within our district wellness committee, such as with the Carroll County Coalition for Public Health, will continue to be a tremendous support to our students, staff, and families. Counselors can continue their work with students in a model similar to telehealth appointments in ways that families are likely already familiar with. Counseling at the high school level, as we know, encompasses many facets of a student's learning experience. The high school has already established timelines and protocols for logistical aspects, and they're confidently planning for consistency in how and when they will meet with students, how to assess readiness to engage or re-engage, and how TASK, Teacher-Assisted Student-Centered program, can support students' emotional well-being in addition to provide academic support.
Excuse me, Heather?
Yes.
Could you just take your mask off while you're speaking in the mic? If community TV is having trouble picking up.
Sure. Sorry.
Thank you. Appreciate that.
Good, my glasses were fogging up too.
Thank you.
In conclusion, we know that students cannot be ready to engage in learning in any model, pandemic or prior, if they do not feel physically or psychologically prepared. Our focus is to implement strategies and supports for students, families, and staff members for any model of reentry, as well as to ensure a screening and referral system for individuals to access supports when needed. We recognize, as a school community, the privilege and duty we have to support not just the academic progress of your children, entrusted to us, but their emotional well-being as well, no matter what the model may be. Thank you.
Thank you very much, Heather, and thanks to that subcommittee. Our last subcommittee is sorry, I have to take the mask off. The last subcommittee is technology. And there are a few simple things here. I have to say Paul Mikowski and the technology department has just been fantastic, ramping up in the spring to get us ready for what happened and continuing to get ready for whatever the circumstance may be in the fall. So thank you so much. So there are a few simple things here. For sanitary reasons, students will be issued a Chromebook. Technology needs will be part of the second survey sent after the school board makes its decision. And curbside pickup for hotspots will be provided. We know families will need hotspots, and that's part of what we want to survey. And then finally, data utilization will be closely monitored, and adjustments in the system will be made if necessary. And I had to ask Paul, what do you mean by that? And what Paul really means by that is there'll be probably a lot of Google Meets going on, even in the blended model, or if we're fully in school, and certainly if we're remote. So we'll be wanting to watch the bandwidth to make sure we have enough bandwidth, and also watching to make sure that we have the programs that we need to have for teachers. So finally, getting to, I think, probably what most parents are concerned about is what does all this mean for the opening of schools? And so we were able to establish 3 options. Option 1 is in-person and blended learning. And of course, what we want for all children is to be back in school. And we want it to be like it was. And unfortunately, we're in the middle of a pandemic, and there's no way to make it like it was. So we're trying to balance the safety concerns with the need to have children back in school, interacting with their peers, having relationships with their teachers, learning, socializing, and it's just hard. It's a very, very hard thing to try to balance. So option 1 is in-person and blended learning, where half of the student body is in school, while the other half is at home doing projects, reading, research, and online assignments, very much like Katie said when she talked about what the blended model would look like. It doesn't necessarily mean online, but it does mean learning at home through whatever means the teacher feels is appropriate as they plan their curriculum for the week and lessons for the week. Each group would come in 3 days a week and 2 days the next week. So group A, for example, would come in on Monday and Thursday, and group B, Tuesday and Friday, with each group having in-person school every other Wednesday. So 1 week would be a 3-day week, and the second week would be a 2-day week for each group, which I hopefully would help parents with work schedules, because we know how important that is and how difficult this is going to be for families. The other thing that I think it's really important for families to know is that we would try our best to, if you have a child in grade 3 and then one in grade 4, and then at the middle school and the high school, we try to schedule those children together so that the same days would be together for families, so they're not running 2 different schedules. That I think would just be incredibly difficult. And I know each school principal will try to accommodate that for each family. So option 2 is remote learning. We also know that not every family is going to feel comfortable sending their children back to school. There is various levels of risk tolerance, and some people think that maybe full-time school is the right thing, and other people think remote learning is the right thing, and of course there are other people in between. So there will be a remote option. What that's going to look like, we don't know exactly yet. It could be a cohort group of remote learning students taught by Governor Wentworth teachers who also have some reasons why they can't be in front of the classroom during the pandemic. It could be the Virtual Learning Academy, because they have reached out and are willing to provide services for school districts. although they're swamped right now, so they're working out their policies and procedures just like every other school district in the state. It might be remote learning from the classroom, or it could be some combination of the three. We don't really know until we do our second survey and find out how many parents would like to send their children to school, how many parents would like their children to be remote. And also until we hear from teachers as far as what their needs are. The other option is homeschooling, and I want to make sure that people understand the only reason that this is an option up here is it's certainly not that we want our children not to be with us, either remotely or in school, but we also know that there are some families that maybe don't want their children to be in school, and also maybe remote learning hasn't been the best option. I think it's important for those families to know that homeschooling is an option and that there is no truancy that will be filed if parents decide they want to homeschool their children. That's perfectly acceptable under the law, and they're able to just send us a letter. So, you know, I hope people understand that it's not meant to say, oh, homeschool your children. That's not it at all. We want every single child to be a part of the school district. But if parents find themselves in that circumstance, then that is an option that they can take advantage of. So why these options? You know, it's as I said, there is no perfect answer to this. We're in the middle of a pandemic, and that just tosses everything around and makes things difficult for everyone. And we certainly understand as school people, and I know the board members do, how difficult this is for families. We are unable to meet the CDC guidelines and have full-time in-person school. The blended option gives students the opportunity to be in school with teachers and friends some of the time. And certainly consideration, as I said before, would be given to having siblings at each level in school on the same days. With a 3-day, 2-day-a-week schedule, we felt that would give some consistency to parents so that they could plan their work schedules. Blending options allow for students to adjust to the new normal. It certainly is going to be different when students come back to school, and I have so much faith in our teachers that they will make the experience fun for students and will be able to implement the safety measures and at the same time do what they do to make children feel positive and good and happy. And certainly, teachers, I know that's going to be a challenge, but you have always done the impossible. So the blended option, also the safety measures can be managed more carefully with the fewer numbers. Our blended learning provides the best opportunity for academics, socialization, and greater safety. Our neediest students will have the support they need in person. Parents who are not comfortable sending their children, or they have children who are immunocompromised, do have the option of remote learning. Parents who don't want their children online or in school also have the option of homeschooling, although, as I said, I hope we can meet their needs otherwise. And I think probably most importantly, the plan provides the ability to change direction and go fully remote if conditions become unsafe, or to resume full-time in-person learning when safety guidelines change or there is agreement in the scientific community that the virus is under control. So, you know, another question I'm sure that many people have is why, with the cases so low in New Hampshire, why wouldn't we open fully right now? And so, again, we're unable to implement the CDC guidelines and return fully. And the safety of our students and staff it certainly has always been my #1 priority, and I know it's been a priority of the school board. Cases of COVID-19 in the last 2 to 3 weeks in New Hampshire are on the rise. The last week of July, 2 persons under 18 were diagnosed with the virus. in New Hampshire. There's still so much unknown about the effect of the virus on children, and we know that some children do develop a serious condition. We also know that children can be asymptomatic and carry the virus to others. And I think another really important indicator is that reports from other countries about reopening schools demonstrates that those schools that have reopened with strict health and safety measures have had the best success. You know, if you compare Denmark and Israel, for example. How will the decision be made to reopen schools fully or resume fully remote instruction? Because we're in a situation where we don't know what the future is going to bring, and things really could go either way. So these are some of the things that would be considered. Are the safety protocols working? Is hand washing, mask wearing, physical distancing, are the students able to do that? Is the plan working successfully? What's the atmosphere in the schools? Are the students learning? Are they happy? What is the status of positive COVID-19 cases in New Hampshire and our region? Are the numbers moving toward community transmission? What is the ongoing medical guidance? What are the changes in the CDC guidance? What new learning is there about the virus? What's available? What options best serve our students really is the bottom line, to educate our students and keep them safe at the same time. I think the district is fortunate. We do have an infectious disease specialist in our community who I've been talking with, and I do believe that we will be able to contract with him to work with us to make sure that as we look at these guidelines, we have the up-to-date information. Honestly, when school opens, I'm probably not going to know all that's out there about what's happening with infectious disease and COVID-19, but an infectious disease specialist certainly will. So it will, I think, give me comfort to know that we have someone consulting with us that can give us guidance on these things. And next steps. So our next steps would be, if the board approves this model or some modification of the model, would be to gather the following information with a reply date for planning. So who would like their children to be learning remotely? We need those numbers so we can start to create a remote option. How many children do not have transportation, because we have to figure out how many children we need to transport and whether we need to do a staggered schedule. We need to obviously continue to monitor the COVID-19 cases and continued monitoring of guidance from medical, local, state, and federal organizations, including emergency operations officers and public health officers, physicians, and local hospital, which I have to say I want to give a shout out to all those folks, because I've had lots of contact with each one of these groups, and they've been very supportive and very helpful. And as we move through this pandemic as a community, I know that we will be in touch and in constant communication with each other. Consider the needs of teachers and staff. We also need to consider what accommodations our teachers and staff might need. Not only do we want to keep our students safe, obviously we want to keep our teachers and our staff safe. You know, we want to keep everyone safe. Principals will work with staff to develop processes to implement the reopening plan in their schools, including working with parents to configure groups of the two groups of students. And I did have a parent question today about, would we consider giving parents a choice of schedule? If a parent needs a certain schedule, we certainly will. We want to work with families to make this as easy as possible for families. And next steps continued. There's lots of things to be done with ordering of protective equipment, desks, and materials for mitigation, and that certainly will be ongoing, determining the personnel needs and also what remote learning will look like. Continuing alternative alternative virtual activities for traditional fall activities such as open house. Consult with medical specialists on an ongoing basis, and hopefully we'll have an infectious disease person on board. And much, much more. The devil is in the details always. And finally, I have gotten several emails about sports, and I think probably the school board has also. The NHIAA has delayed the beginning of the sports season, and the beginning of practice has been moved to after Labor Day, and the season is set to start after that, depending on the risk level category each sport is in. So each district is going to be making its own decision about that, and the athletic department has submitted a plan to be considered, but that is going to be considered separately once the reopening plans have been solidified. So with that, I thank you for your attention, and I believe that this will be time for public input and for questions. Thank you all so much.
Great presentation, Kathy. Thank you. We did get one email or a text message from somebody that was watching on YouTube, and they just asked the question if there's a Monday holiday in the Monday-Thursday students, how is that going to be handled?
Well, you know, that's a good question. We'll put that on the list.
Another thing to consider, obviously.
Thank you.
So at this point, we would like to hear from anyone in the audience who would like to speak and give us their input. We're here to listen tonight and understand your concerns, your hopes, and all of that. There's a mic right in the middle of the auditorium here, so anybody that would like to speak, please go up to the auditorium, to the microphone. When you get there, please state your name and the town that you're from so we can kind of document who might want to speak.
Roger Decato. My kids go to Carpenter and Kingswood. I have a couple questions first. My oldest daughter, she did in the early child development program. Will that still be running? Magic Moments, it's called. Next is, will band or chorus take place? I have some concerns about the mask being worn all day.
And excuse me just a second. If you don't mind, you could take your mask off just to speak into the mic.
Sure.
Thank you very much.
Is that better?
Yes, great.
Okay. Second, the mask being worn all day. As you see, it's hard to understand. So children have questions. So will their mask have to stay on? Can they come off? There was the criteria for mask breaks. Is that going to be each classroom gets a certain time for a certain amount of minutes? Also, are there any long-term effects about breathing through a mask for all day long? Children's lungs are still developing. To the sports, the athletes won't be wearing masks, of course, if they are sports. Why is it acceptable for them not to wear masks, but if a child is in a shielded desk, why couldn't his or her mask be removed in that area? And a question was about the high school cafeteria. So it said social distancing, so that means like all children or kids will be 6 feet apart. And for dropping kids off at school, there's only so much area in front of Carpenter School for staff to come out and get the children. Is carpooling allowed?
Is what was that?
Carpooling?
Okay, thank you.
Do you want me to answer?
Sure. If you have an answer to any of those, that's fine. If not, we'll review it later on. But sure.
There has been ongoing conversation with the Children's Center about Magic Moments, and it's not likely that we're going to be able to offer Magic Moments this year. As far as band and chorus goes, because of the droplets and the respiration involved in singing and in playing an instrument, the music folks will be retooling the curriculum, and that practice is going to have to happen at home. So there won't be singing and there won't be instruments. Mask wearing all day, I would like to work with either our pediatrician or our infectious disease specialist to develop a criteria for the mask wearing. I think it is going to be important to have mask breaks, but we want to make sure that that we're consistent about that we don't leave teachers just hanging out on their own trying to decide, should I, shouldn't I? So there will be criteria for that. Long-term effects of mask wearing, I don't know. I think that we're just at the beginning of this, so I have no idea of any research that's been done on the long-term effects of mask wearing, but I do want to share with you something interesting I heard on the radio on the way here today on National Public Radio, that MIT is developing a mask with particles in it that will actually diagnose COVID. So I think that we're going to see a lot of changes over the next several months, and that one just fascinated me. I mean, we may not see that for a long time, but I think we're going to learn a lot of new things, and we're going to be able to deal with this maybe more effectively as we learn more things about it. Long-term, sports. Well, we have, the board has not made a decision about sports yet, so I don't know that we can say that there'll be mask wearing in school and not mask wearing in sports. I think all of that is yet to be determined based on the plan that's been submitted to the board and, what the conversation with the board is about that plan as it relates to safety and the transmission rate in the community. High school cafeteria, yes, it will need to be 6 feet apart. That is going to be a change, and it's not going to be easy. There's no doubt about it. Drop-off, I know that Mary Dolan Myers is probably having sleepless nights about drop-off, and we are going to have to figure out a system to do that safely for everybody. As I said earlier, the devil is in the detail, and there is a lot of detail that needs to be figured out here, but where there's a will, I think there's a way. And carpooling, I don't think carpooling would be recommended. There's nothing that the school district would be able to do if families decided that, maybe you have people in your bubble, and those people in your bubble you feel really safe with, but that's really beyond the purview of the school district.
Okay, thank you.
Thank you.
Hi, I have a question.
If you could drop your...
I'm not going to drop my mask.
Oh, okay, well,
Thank
just
you.
speak loud enough then.
I will. So my question is about high school. I have a couple of questions about the high school. I have a high schooler. One is the children at the high school, they move their classes from class to class. So they're going to constantly be getting new cohorts every time they move their class, which actually then puts them at a greater risk and could potentially move COVID around the school more. So what I'm wondering is if for the first semester, if there's thought going in to keeping children with their cohort and moving them from English to science to history just at the beginning of the year until this, all works out. And then they can go back to having all their extracurricular classes and not just their main core classes. So that's one. The second thing is, when I was reading through the pamphlet, I noticed that busing potentially could be a huge issue, which you had spoken about. But one of the things was that bus drivers will be taking their own temperatures, and they'll be checking in on their own. And the children. So will the bus drivers be checking the children's temperature before they get on the bus? Or are children who drive from an hour away going to be exposing the whole bus for a full hour before then the children get here? So I think those are just my two main questions I have right now. Thank you.
I don't know how possible it's going to be. We certainly, the high school principal and myself have certainly had some discussions about cohort groups and how to keep cohort groups together. I can't guarantee that that's going to be possible given the way the high school is structured and have students take the classes that they need to take. So, you know, again, devil is in the detail, but there'll be more discussion about that, but I have to be very frank with you and say I don't know if that's possible. In terms of the bus and temperatures, I think you raise a very good point. That's why we're looking at perhaps a software program where parents can take their children's temperature, download it onto the computer, and then send it to the school nurse so that when they walk out the door and get on the bus, the temperature will be taken, the checklist will have been completed. You know, again, devil is in the detail. We need to work some of these things out. We're sort of building the plane, you know, just before we try to fly it. Good question.
Hello. My question is, how will things like clubs and theater be executed? Are they just not happening, or is it up to whoever is heading or leading those activities?
Well, we are getting, I actually had a discussion with the theater director today about that, and honestly, my assumption was, you know, that we wouldn't be able to hold theater activities, and I was feeling bad because for the kids, for the teacher. However, there are some guidelines coming out from the state about how to do that safely, and so I think we would want to take a look at that. We wouldn't want to dismiss it out of hand because we do want to be able to provide whatever activities we can provide for the students safely. So I think that's yet to be determined.
Okay. Thank you.
Okay, one quick question, and it's just been brought to my attention, and probably a good idea. Do we have any sanitizers by the mic in the front?
We do. There should be some sanitizer wipes by the mic.
It's much better if you can remove your mask and speak into the mic because we can hear you a lot better. If you do, it would be great if we could kind of wipe the mic a little bit between speakers. If you're more comfortable keeping your mask on, it's perfectly fine. Just make sure you speak well, as loud as you can into the mic so we can hear you okay. All right? Thank you.
This sucker's staying on. I'm Kim Keith, and I have two littles at New Durham Elementary, and I just wanted to get some clarification on the lunchroom situation. Like, it doesn't say anything about whether or not we're allowed to send our children in with their own lunches, because everything is going to be disposable packaging. So I want to be very clear, are we allowed to send our own kids with their own food? And then my other question is, toward the end of the presentation, there were indications about, do we keep doing this based on, are the kids happy? Are we able to do the hand washing? Is it going to be, like, say you have a child who's not the best about that, are they going to be asked to, you have to do remote learning because you can't follow the procedures? Or is it going to be a whole school-wide thing of, like, if it's not working for 10 kids, is it not for everybody? Like, how is that going to be handled if, like, a couple people just aren't falling in line?
We certainly wouldn't close a school because a couple of children are being non-compliant. It will be a requirement, and we'll try to work with parents. There, as I said earlier, I think there is some information about how to work with young children to help them be positive about wearing a mask. We have been ordering some masks with school district logos. Well, not district, but like the otters for Crescent Lake and the school. Some kids that are into Spider-Man would really be excited about wearing a Spider-Man mask. So there are, I think, some ways that we can make this as fun for kids as possible. I mean, this is not a fun situation, and I certainly don't want to paint it that way. But, you know, there's a way to work with kids and to get them feeling comfortable and not anxious about the situation, and we certainly will do our best to do that. And your other question was, about the lunches. We would encourage parents to send in lunches if they feel more comfortable. That is absolutely, absolutely fine. Should you want to do that instead of having your child have breakfast and lunch at school, that's perfectly fine.
Okay, and just related to that, does it have to be disposable, or can they bring their own packaging and bring it back and forth? Like, are they going to be able to also bring their own backpacks? Like, just stuff
They
like
can
that.
bring their own packaging and bring it back and forth. I know that what we'll be trying to do in the schools is to keep that separate from everyone else's, just to keep everyone safe.
Okay, thank you.
You're welcome.
Hi, I'm Monica. I'm from Effingham. I have a few questions, and I have kids who span from elementary school to high school, so it'll kind of go across the board. My elementary school question is, can you elaborate on why we not only have social distancing and mask requirements, but are having our kids in plexiglass boxes, and what your plan is for the mental health aspects that's going to have on an elementary school student, as well as easing the transition now for incoming 7th graders who are now not only going to have no introduction to the middle school, but then be forced to wear masks and be in plexiglass boxes. And is it now going to be okay for a high schooler who was going to graduate early to do those classes on VLAX, which previously was not going to be allowed, and graduate?
Okay, thank you for those questions. As far as the different things like masks, social distancing, and plexiglass, I don't know if you've heard anyone talk about layers of mitigation, but with each layer, there's an increased safety factor, and so that's the reason that we're looking at masks, physical distancing, and plexiglass shields. And no doubt, there is going to be a difference in schools. I think we all understand that, and I do have faith in our school community to work with kids so that they don't have a lot of anxiety. And I think you've heard from the mental health, social emotional considerations, some of the things that will be put in place for that. But, you know, you're right, it will be different, and I wish it could be otherwise, I really do. But there will be some differences. As far as the VLAX and the high school principal and I have talked quite a bit about that and about what being flexible about the requirements for VLAX. This is a different situation. We've not had a pandemic before, so this is uncharted territory for us, and certainly we would want to be, we want every child to get a high-quality education, but we certainly want to work with VLAX, and if a child is meeting the curriculum expectations, then we'd certainly want to give them credit for that.
Yes, sir.
Hi, David Cash from Tuftonboro. I have a middle school student and a high school student, and it's a question on the technology. You said students will be issued a Chromebook. They were able to use their own computers last year, which did not work well. Are they mandatory that they're issued a Chromebook? Because my older one found it much easier to get online and play games than to actually do school. So if you were to tell him he had to use your Chromebook, it might work a lot better.
If you would like a Chromebook, that would be absolutely fine. If you prefer that your child work with the computer that he has at home, that he or she has at home, that's fine too. So.
Hello, my name is Adam Tasker, town of Wolfeboro. First of all, I'd like to thank the task force for all the work he did. I've been on task force before, and I know it's a lot of work. But here I go. I don't have a doctorate or a master's. I don't have a bachelor's or an associate's degree. I graduated from Kingswood High. I have what's called common sense. Does anybody know the number of positive COVID tests in the towns that are in the district?
I do, actually.
Okay.
As of Sunday, I have to actually look at my notes here. New Durham had, and again, it doesn't have the exact number, but New Durham was 1 to 4. Tuftonboro was 1 to 4, Wolfeboro was 1 to 4, Brookfield was 0, Effingham was 0, and Ossipee was 1 to 4.
No, actually, I mean from the beginning. So from the beginning.
Oh, no, I'm sorry. This is right now.
Right,
This
currently,
is right now.
currently.
No, I don't know from the beginning.
But from the beginning, with the 1 to 4s, if you say everybody was a 4 that was in that category, 36. So we're going to change the way we do everything for 36 positive cases. And I know people are scared. The media makes people scared. That's their job. But there's so many what ifs. The what if people. Does everybody live their life as a what if? I hope not. I feel sorry if you do. It's time to get back to school the way it was. The CDC gives you guidelines, not mandates.
Hi, Heather Nelson from Tuftonboro. I have a question. So if I understand correctly, parents have 3 choices, in-person and blended, the remote learning or homeschooling, and parents get to choose that, correct?
Yes.
Okay. So for the remote learning, my understanding you were talking about sending out a survey. I know as a parent, I'd be wanting to know a little bit more, and I understand you said that you're still working out what that looks like. You know, just if I were a parent who had a child who had a medical condition that made it difficult for him or her to be in school, and my child was a senior, and you know that this was a year that really mattered. There's AP classes, there's honors classes. I guess I'm just wondering, as you look at what remote learning looks like, would it be, or at least possibly if you think about what that could look like, just to offer some possible ideas, could one of those live classes, so like when you talk about separating into cohorts of A and B, could you, let's say, could we record, like you assign the kids who are full remote to an A or B cohort, and then their classes are recorded, or they could stream it live possibly? I'm not saying that the teacher stays behind their desk, but like if there's a camera in the room, I know for myself, I think that if you had a child who was really motivated to do well, but they had a medical condition, they might say, well, I'll take my chances because I don't want to miss out and on my senior year, so I would want to make sure that he or she didn't miss out on any opportunities as a result of, you know, having to do remote learning full time. Thank you.
Yes, thank you.
Hi, Nicole Bailey. My kids are at Tuftonboro Central. I have 4 or 5 questions, so bear with me here. For remote learning, should we expect a similar approach to teaching as in the spring, or is more thought and preparation being put into how to make it more enriching for our children? I haven't talked to one parent who their child had a very positive experience. It was very mixed results, and I think a lot of children, we felt like their educational experience declined because they didn't have the interaction with their peers and their teachers. We're also only a month out from school actually starting, and I'm hearing a lot of comments tonight stating that you don't actually know what teachers are going to be with the children if we choose remote learning opportunities. So that doesn't give me a lot of confidence in the fact that we know exactly what that curriculum is going to look like in advance of school starting. If we choose to homeschool our children and we then want to convert them back into the school when things return to kind of pre-COVID conditions, is that possible? Or if we choose to do homeschooling, are we stuck with homeschooling for the entire year? As well, if we're choosing schools outside of this district or private schools that have less strict guidelines, will we be able to, when things return back to normal, put our children back into the Governor Wentworth school system? If children can't hear their teachers, as we're having trouble hearing you tonight and we're having to remove our masks and you yours, how are we going to address that in the classrooms? I think that's a huge concern at this point. That does it. Thank you.
Okay, thank you. I think that of those questions, the ones that I think can be answered are the homeschool and possible to return. Absolutely. As I said, we want every student in Governor Wentworth, and so as far as the remote learning, we would be asking that parents commit to that for one marking period to get a sense of whether it's working for their child, and if it's not, then if they'd like to come back, that's fine. But the marking period, I think, is a good place for that transition to happen. I don't know about classrooms are smaller than an auditorium, so I think probably children will be able to hear their teachers. And will we be able to return our children to school? I think I answered that one as far as the remote learning and the marking period. So thank you for your questions.
Hello, my name is Trisha. My daughter goes to the high school. She'll be a senior this year. I have a couple questions regarding the Lakes region. Is the appropriate place to ask that? She's in HOSA, and I know they do clinicals and labs, and how are they going to do that if they reduce their class sizes and such as that?
Mm-hmm.
Second question, or more of a statement, anyone who has a child who has ADD, who doesn't really fall into the special needs, but if anybody has an ADD child, they know that they definitely fall into those. Remote learning is not good when you're required to do visuals, which is fine, but some of the kids are fishing during class or bike riding with just headphones while the teacher's speaking. Very distracting, not super helpful. The remote learning was okay, but I had my straight A student get credits instead of being able to get her grades. Didn't work as well as we had hoped, but I knew it was short notice and not very helpful. But just as a point, looking at those classes from a child who doesn't sit still's point of view might be easier to make the class towards those students. Just a thought. Thank you.
Okay, thank you, Tricia. We are in conversation about those classes at LRTC that in fact have special certifications and require clinical hours. So the LRTC director and myself will be working on that. And certainly we don't want those students who have those clinical hours and who require those face-to-face experiences to suffer from this. So I do believe we'll be able to work something out. And again, the devil's in the details, and we're just beginning this, but I do believe we'll be able to work something out.
Hello, my name is Jessica Williams. I live here in Wolfeboro. I have 2 children in the district here. I have a few questions. All right, I also graduated from Kingswood High School in 1999, year of Y2K. Everything was going to fall apart, but it didn't. And you said there were 2,400 students here in the district, and I'm going to do some simple math because I did have Mr. Fagan as my teacher. He was a great calculus teacher, but this is just some basic arithmetic, okay? 2,400 students in the district. If you look at the number of children that that account for the infection rate, it's 8.8% national average. So we have 200, and let's say 12, because we're not going to have little bits of kids here. So let's say 212 kids are going to become infected with COVID, potentially in the district. So basically, school's not going to happen, because you're going to close the school, right? Every time there's an infection, just close down. Now, of those 212 infections, we have a 0% to a 0.3% death rate. And I know it's not nice to talk about death. We don't want any kids to die, but we're talking about potentially 2 children that could die in this district. And you're going to disrupt the lives of 2,398 children and their families so that potentially 2 kids can be saved. I don't understand why we're going to be doing this. So that's number 1. Has any one of you read any of the 39 articles that the CDC also recommended reading about how not putting children back in school is more damaging to their mental health, their intellectual life? And also, what about the kids that are being abused at home? Is anyone checking up on them? Do we know? Are they seeing anybody? Because they're at home. Is the school board willing to provide parents and taxpayers with data regarding attendance and student performance in real time so that we can respond and decide on what's best for our children as a community? For instance, I've heard that up to 50% of students were missing at least one class a day in the high school this spring. Can you refute that or provide any more information? Who is responsible for providing or oversight to teacher performance, and what metrics are you using?
I think those sound like rhetorical questions. Okay. In terms of, I honestly, I don't know what to say about the number of potential deaths. I think I'll just leave that. CDC articles, yes, I think all of our committee has read those. Kids that are being abused, yes, I think that our counselors have been reaching out, and there is a plan for that. And I'm sure that if you want some data, we'll provide that for you. Oversight for teacher performance, we have an evaluation system, and our teachers are supervised and do a great job.
You said I have 5 minutes, so I'm not done. You really didn't want to answer my questions, I understand. Answering questions is hard. But parents need to be involved more. As a parent, my children suffered last year. And I don't know how many of you have children. I'm sure many of you have had children. But as a parent right now, in the middle of all of this, watching your child suffer intellectually, socially, physically, is not fun to watch. None of us want that for any of our own children or anyone else's children. How can you involve parents more so that we can actually give feedback on the teacher's performance? Because you know what? Sometimes my kid only saw their teacher for 30 minutes an entire day. That is not okay. It is not acceptable, and we shouldn't stand for it. What are you going to do about it?
I have to agree with you on that 30 minutes a day is not acceptable. And I think if you look at the plan that discusses what the remote teaching expectations are, that again, we were building the plane while we were flying it, and honestly, I think teachers did a remarkable job. Was it consistent across the district? No. Did everyone know exactly what should be done with every element of technology? No. But I think they did a remarkable job for what they were faced with. I think we've had a little bit of time now to plan and to look at what remote education should look like. And I think if you look at the plan, you'll see that there are standards at each grade level appropriate to that developmental age.
You know, it's on now. Jessica, I empathize with everyone here. All of us, I know many of us still have kids in this district. I've watched my daughter lose a year of college and a second one because there's no clinicals in Boston. And I can tell you, I sit here understanding what you're saying, and I know everyone on this board does. And I want, personally, we are taking everything into consideration. And I can say her professors were the same. They were flying by the seat of their pants as well. They didn't even have the resources this district does. I can tell you that at a school in Boston. I'm very proud of what we were able to do. It was not perfect. And I can tell you, we want to make it better. It's patience. It's, you said the teacher was there for 30 minutes.
Did you communicate that to someone besides today? You know, you have to communicate. And I think that we are all trying to do the best that we absolutely can. And everyone is suffering, and it's a nationwide thing. It's not just here. And I think if we allow everyone patience and kindness and just feedback, and I think we're doing the best that we can. I'm very proud to sit here. I'm very proud of the teachers. I'm very proud of the administration. And, and to Adam's point, it's hard. We're doing the best that we can, and I appreciate your feedback. But here sitting on this board, yeah, we absolutely know what it feels like firsthand. Thank you.
I'd like to ask a couple more questions, please. First, I'd like to say thank you. This spring was rough for many of our children. I have a child who actually struggled all spring, and he is a straight A student, AP kid, honors kid, has it all going for him, and there isn't one teacher who would have known my child was struggling. And we did the same thing. We did the no credit, no credit, and he just took credit to take the grades off of him. So thank you for everything you guys did over the spring to help our children. Really appreciate that. Given the tone of the room, I'd like to ask a question about substitute teachers. Will substitute teachers be hired before the school year? And will they be trained to keep masks on and to help control proper COVID situations in the classroom? So that is one question. The other question is custodial staff. Are you increasing the custodial staff to help clean the schools and help clean the rooms, like when the kids are out on breaks and at lunch? Thank you.
Testing. Oh, not great. Yes, we will be training. We will be training substitute teachers. As far as custodial staff, we have taken a look at how many additional hours it will take to clean our buildings and sanitize as far as what you've seen in the plan, and we will probably need at least an additional, I would say, 10 to 15 hours a week.
James grew up, 2 kids in Tuftonboro. And I just wanted to make a comment on something that was said earlier about I think it was 2,400 kids and 2 average passing. I have 2 kids, and we're all navigating this together. I'm scared to send my kids to school, but I'm not. I understand the common sense part of it too, but God forbid it would be one of my kids, one of the 2. I don't think anybody here wants to put anyone's kids in danger or have your kids bring home something because they're asymptomatic to your grandparents. So it's not just, let's shut the school down, let's not shut the school down. It's something we're all navigating here. And I think what you guys are doing is really great. We're trying, we're all trying, and I think that needs to be said. This is something that's new. The spring didn't go well for my son either, but I don't blame that on anybody up there or the teachers who they didn't expect this to happen. We should all just work together as a team here and try to make this a really smooth transition, and hope everyone stays safe and stays healthy.
Thank you.
Is there anyone else that would like to speak?
My name is Brett Williams, and I'm from Wolfeboro. I have to work, and I don't feel like what we have now, the school's going to be closed down at some point, I believe. And I have a hard time working from home or going to my job and also being like the homeschool teacher for my daughter. So I need some sort of stability in my life so I can properly function and provide. So I think the best thing for me would be to homeschool, but I would have to have financial resources to do that. Is there anything in the school district that is going to redivert funds for parents that do that to help financially support them to find a tutor or whatever it is to educate their child during the year?
There's certainly no financial support available, but I do know that if you reach out to your child's teachers, that they certainly, or administration, they certainly would do the best to support you in your endeavors at home. But financial support, no. Heather was just saying that the Virtual Learning Academy, if you took advantage of that, there is no cost to that. But I think that still doesn't take care of the fact that you're saying that you need to be at home, and that's just a difficulty that I think a struggle for all parents. This is not easy for anybody.
Hi, Emily. I have one son in New Durham. Another one who might be going there, we're not really sure. I guess along the lines of what he was just asking, I'm not a single parent, but essentially my husband's job, he's essentially on call 24/7. So I am like a single parent. I do not have a job that I can work from home. I have to be there. I work with patients. So there is kind of that, where are we? We're kind of left in the lurch, I feel like, a little bit. So just kind of curious if there's going to be any community support, or if there's any discussion of community support, or parents maybe helping each other, anything like that. And then my other point, I have a child who did pass away, and I watched my child die. And he was very young, but I'm going to tell you right now, I don't wish that on anybody. The one thing I asked when we were in the hospital saying goodbye was that if there was anything I could do to ever stop another mother from having to be in my shoes, I would do it. And so if that means that I'm stuck in the lurch for work, if that means I have to take time from work so that somebody else doesn't have to go through that, I am 100% okay with that. And I appreciate everything that you're doing. I know we're waiting for the data to come in. I know we're watching other schools in other countries and other parts of this country. And so I just want to say thank you for that. And that's that. Thank you.
Thank you, Emily.
Thank you.
I just have one more question. I have a question regarding what kind of supports and are going to be available to district employees if we are in a hybrid model and we're all having to work and our children are on a 2 schedule, 3 schedule, 2 schedule, 3 schedule, but yet we're still district employees for 5 days a week.
Good question.
Yep, it's a good question. And there's not, I think district employees are in the same situation as the rest of the community. These are very, very tough choices, and there is no silver bullet. There is no answer to some of these dilemmas. They're just very tough choices.
Hi, my name is Sarah Bird, and my daughter will be at Crescent Lake in 4th grade. Is there any thought right now about when we think about the school potentially reopening, so going through this phased plan of the hybrid model, when will there be any specific milestones that are going to be put in place about when the next decision point would be? Because it seems to me that there's been so much work that's done to create this plan. It seems very thorough and very thoughtful. there's a lot of passion that I'm hearing in the room around people obviously wanting their kids to be back in school as soon as they possibly can be, because we all know what the benefits are to an in-person environment. And it just seems as if there were some, it might help the community feel more comfortable to know that when the specific milestones are going to be put in place as to when the next decision point will be and what those decision points will be.
Thank you. That's a great question. If you look in the plan, I believe it says 4 to 6 weeks, and I'm quite sure that the school board will be discussing it at the next school board meeting, which will be prior to, when I say next, I mean the next after school opening. So that would be probably prior to the 6 weeks. And as I said earlier, I think because this is such a changing situation, to have someone from the medical community helping us. I'm particularly interested in working with an infectious disease specialist to help us with the guideposts, help us keep current with what information is out there about the virus, because this is just such a changing situation. And we can watch the numbers, and that's good, and it's important, but we also need to be aware of what the most recent research is saying. And I know that when September comes around, I'm not going to be able to do that in my role. So it will be very helpful to have someone on board that can guide us in that regard. So thank you very much for that question.
Hi, my name is Steve Johnson. I'm from Wolfeboro. And if we're following the CDC guidelines, does the CDC have any endpoint in mind? And by that I mean number of cases on a given month or weeks or whatever, or is it number of deaths that might occur? Is there some kind of metric that they're following that if we reach a certain point, a certain level, a low level, that in their eyes would be safe to fully reopen? Do they have that figure or that number or anything like that in their projections?
I really wish they did. That would make everything so much easier, but they don't. And as I said to a little bit earlier, that this is such a changing situation, and we know so little about the virus that we need to be watching the science, watching the research, and making decisions based on that. And the CDC does not have an endpoint. Right now, the big discussion is community transmission. And that really is not an endpoint. That's really when it's recommended that businesses, schools, et cetera, close. And honestly, to be very frank with you, I would like to certainly put in place a procedure to close before we get to community transmission, because I think that's a little bit too late.
Hi, my name is Deidre. I have a son at Ospey Central School. He's a special needs child, so we're kind of weighing all of our options and what that looks like. But I just wanted to let parents know, you had asked a question about funds. The Children's Scholarship Fund of New Hampshire just got given another $1.5 million so that you can choose what to do with your child education-wise. We've used it for tutors, and also to send to a private school, and the average is about $2,500, so that's an option up there. Thank you.
Ernest Brown from Brookfield, and COVID-19 is something we've never worked with before. It's a new pandemic. Kathy Cuddy-Egbert and the school board are working to make it as safe as possible. It is terribly stressful, especially for the parents and teachers, because they're working with an area that they don't know the answers. And the parents, when I hear this schedule of about 3 days, 1 week, and 2 days the next, and most of these parents have both husband and wife working, it's incredibly stressful. So I would merely ask that for the public, communicate your concerns through the school board. Kathy Cuddy-Egbert is only one person, and she can't answer every phone call. But if you would communicate your concerns as you get into the process with the school board members, and then they'll feed them back to the administration, it would be very helpful to get this entire procedure behind us and get back to closer to a normal schedule someday sooner. Thank you.
Thank you, Ernie. And just so you know, while this has been going on, I've probably received a dozen or more text messages from people that are watching on YouTube, as well as at least a half a dozen emails, again, from people that are on YouTube that we're going to try to respond back to. Not tonight necessarily. We'll have to share those with the board and understand where we're going with those questions, and so we can answer those appropriately. But obviously, there's comments from people that aren't here, people that are here, and we're going to try to take everybody's input and discuss it and make the best decision we can when the time comes. Yes.
Hi, my name is Sarah Hart. I'm in Wolfeboro. I guess my one concern is having a son that has speech problems. Is it something for my decision if I need him, depending on what his IEP tells him he needs to do, that as that parent I could send him 3 days a week, every week till his speech is improved? I've noticed when he had speech therapy at the Children's Center in person, he did much better, but it was super difficult to get him to sit still to do speech therapy at home. He's my one concern for starting kindergarten, where he'll need the speech therapy and a bunch of other classes, on top of all, if we have to do full remote, all the classes that go on top of that for kindergarten.
Yes, another really great question. If you have a child with special needs, I would encourage you to get in touch with your school's team. And it may be that, I don't know that this is the case for your child, but there are certain children that will need education 5 days a week, and that will be provided. So you do need to be in touch with your team. Our special ed director is on top of all of that and has been working with our diagnostic prescriptive teachers in every school. So please contact your school and set up a meeting.
Okay, thank you.
Okay, anyone else? If not, we can kind of shut down the public input section right now. Okay, seeing nobody else coming up, we've been here tonight to listen to your concerns. As I just said, I got at least a dozen or more text messages and another half a dozen or more emails while this meeting has been going on. We are not going to discuss this around the table tonight and make a decision. There's too much for us to absorb and to really think about between now and when a decision is going to be made, and that decision will be on Thursday. We're going to have another school board meeting right here Thursday night. I'm going to be able to share the emails and the text messages that I received tonight. We also have a packet of emails and texts that were given to us earlier that have come in over the last day or so. We want to read through those, understand exactly what everybody's concerns are before we discuss it among ourselves, what the best option might be. We're going to try to do what we think is best for the students, for the teachers, for the families. This is not an easy decision for us, and it's certainly not an easy decision for you. But we're going to be back here Thursday night at 7 o'clock to discuss everything that's come into us at that point and try to make the best decision we can for everybody concerned. Seeing that, we're going to move on to just my report as chairman. We just have a couple of correspondence that have gone out. We sent an expression of sympathy to Sandy Hill on the passing of her father, and to Robin Cornwell on the passing of her son. And we sent congratulation wishes to Kyle Strauch on the birth of his son. So at this point, we'll move on to committee reports. Anything from academic affairs? Okay, building and maintenance, Julianne, anything?
Update, foundations have started. The panels have been received. Good song. The panels have been received, and they will start to go up next week. So, for the solar project in Effingham, sorry.
Thank you, Julianne. And again, thank you, everybody, for coming tonight. We really appreciate all your time and effort and input, and we'll try to make the best decision we can possibly make. I have nothing for finance or human resources tonight. Advanced planning, our next school board meeting, as you just heard, is going to be Thursday night at 7 o'clock right here in the auditorium. Really closing comments, I don't know if we really need closing comments tonight. I think we've heard a lot. So I think we can move right on to a motion to go into non-public under RSA 91A, semicolon 3, paragraph 2, for personnel matters. Okay, moved by Dr. Jim. And seconded by Tim.
Charlie.
Who?
Charlie.
Charlene. Okay, Charlene, second. Okay, Krista?
Yes.
Julianne?
Yes.
Tim?
Yes.
Wendy?
Yes.
Dr. Jim? Jim Pittman?
Yes.
Charlene?
Yes.
Dana?
Yes.
Chair votes aye. Okay, we're in non-public. Thank you very much. Good job.